So you want to go into
Welcome back to Tennessee Valley this morning on WTMB. Joe and Kim Palo with you still on this Wednesday. We are now joined by Dr. Subroto Kundu, who is a neurologist consultant, who's going to talk to us today about some more interesting things about your brain. But real quick, Dr. Kundu, my brain, I wanted to know what, if you can just tell me this has nothing to do with what obviously we're going to talk about, but in your position, what is the difference between a neurologist consultant and just a neurologist, or is there a difference?
There isn't really. I mean, consulting means a neurologist is what you would say a super specialist.
Okay.
I mean, the general overall field is medicine.
Okay.
And then various aspects of medicine, there are people who specialize in it. For example, a cardiologist is somebody who is, after all, a doctor, who is a physician and basically an internist in training, but then they specialize on the heart. So they become a cardiologist, and a cardiologist therefore serves as a consultant.
I was wondering what, the whole situation there, and then of course I guess if you specialize in that particular field, then you are a consultant.
That's right.
To the other medical doctors.
Yes, they are.
Okay. Now, today, our topic, if you'll enlighten us, what's our topic today?
Well, degenerative disease, I think, is what we were going to talk
Parkinson's.
about. Like Parkinson's. Like Parkinson's, that
yes, I mean,
degenerative means that it starts to break down certain parts of the brain, maybe? I don't really know.
Well, the neurodegenerative diseases are a whole group of illnesses, as I think I mentioned at some point in one of our other discussions, that you do not have any more brain cells ever than when you're conceived. So you have
most everything else generates. They will produce more and they'll regenerate. But now the brain, when you start losing them, you don't get any of them back. So
you always lose them.
Right, we're always losing them. So don't do anything more to lose them because you don't get them back.
Okay. Well, to expand on that a little bit, like our skin cells are being formed all the time.
Right.
So even if you are very, very elderly, even then your skin cells are being regenerated. Your blood is being regenerated. Your bone is being regenerated. So the many parts of body tissues are regenerated. Whereas in the brain, you have exactly the same finite number of brain cells that you were conceived with. When I say conceived with, that is even before you're born. So about like 6 months of gestation, that's about all the number of brain cells you're going to have. So from that point on, either you can hold on to those cells or lose some. So then the growth of the brain happens apparently because of growth of the individual brain cells, and then their ramifications and their appendages and other supportive cells that come on. So the brain of a baby is smaller than the brain of an adult, so there is growth over there, but not in the number of cells.
Right.
Wow.
So then you come into adulthood, and after that, through midlife, there is a loss of brain cells, same as there's loss in your hair and loss of many of the other body cells. They do not regenerate to the same degree as they did earlier in life. Now, certain diseases have an accelerated degeneration. Why? We don't always know. But there may be some metabolic problems, there may be some chemicals, they may even be viral agents and things like that, which we sometimes can't even identify. They cause a drop of these brain cells at a much faster rate than what you would call normal aging. So in a normal aging, there is definitely this loss, and you see that in what we call brain atrophy. So brain atrophy is a term that we started using once we started imaging the brain with a CAT scan and an MRI. So with those tools, we can actually visualize the brain and see what is the brain substance and how much it fills the cranium.
It shrinks. That's my father. Right. They would do that with him when he had the people with the dementia.
Exactly.
And we would get the scans to see how much it had
shrunk. So when you use the word dementia, you are actually saying that there is a loss of mental faculties, and you can actually see that there is a shrinkage of the brain. Now, we already know, and we agreed on that there is going to be a shrinkage with age, but then there is an accelerated shrinkage. Then not only there is an accelerated shrinkage, but then certain areas of the brain may be predominantly affected by that disease process. For example, Alzheimer's. Right. is a classic neurodegenerative condition. We do not exactly know what causes death of those brain cells, but they begin about in the deep part of the temporal lobe where our memory functions are situated, which is the reason why the first manifestation of Alzheimer's is going to be with memory. Now, if you had that same type of degenerative condition, then it affected the one part of the brainstem, let us say in the midbrain, and a small area which kind of looks black, which is why it's called a substantia nigra. Now that area we know is related to a lot of motor activity. And if that area is affected by a neurodegenerative process, we would call that Parkinson's disease.
Right.
Then again, there are muscle movement are regulated by the cells of the brain in the motor cortex as well as the deep ganglia in the brain, and they innervate our voluntary muscles. Now, if you have a neurodegenerative process that primarily affects them, we call that motor neuron disease.
Okay.
So, let's say these are 3 examples, and there are many others, where we have been able to identify these syndromes where the neurodegenerative process, we do not know exactly what causes these things, but they predominantly affect a certain specific cells of the brain. Now, the degenerative process doesn't restrict itself to these particular cells. So, in time, with progression, you will find that the degenerative process affects other cells too. So, when you have Alzheimer's disease beginning in the deep temporal part, deep temporal lobe, it ultimately affects the whole brain. So, then you will find general shrinkage all over the brain, and same is true for Parkinson's, same is true for Lou Gehrig's and things like, which is the motor neuron disease is a good example, that you'll find shrinkage all over.
Now, what exactly is Lou Gehrig's disease? I've heard of that a lot, and I know it's degenerative, but I'm not really sure what it affects.
That's exactly what I
and what
described.
the symptoms are. Is it like Parkinson's in a sense, to where do you have
it's your motor skills diminish?
No. The difference between Parkinson's and Lou Gehrig's would be in a Parkinson's disease, it's a movement disorder. That means not that you are paralyzed, but you have difficulty in your movement. So getting up from a chair may be difficult. Even the fact that you want to walk, your foot may not obey you.
Okay.
Which doesn't mean that you're paralyzed, but you cannot perform a task just the way you want it. So then this degree of difficulty may manifest in very many other presentation, but the basic thing, there's a poverty of movement, not necessarily the action of a muscle. Now, that is opposed to the Lou Gehrig situation, where the muscle is actually dying right from the beginning.
So with Parkinson's, you've got that involuntary movement, and Lou Gehrig's, you can't move. When you want to move it, you can't, in a sense.
Well, you can't in the sense that your basic presentation would be with weakness.
Right.
So then you cannot get out of a chair because you don't have the strength to do it.
Right.
Not because you don't have the coordination to do it.
Right.
So in a Parkinson's situation, you cannot really coordinate your movement enough. I mean, if you notice what somebody has to do in the attempt to get up, you will find that if I were to try to get up, I would lean forward, I would tuck my legs in, and then I would throw my body forward, so my body leaned over the center of gravity of my knees. If I don't do that, then I cannot actually lift, and then the power comes in.
Right.
So what seems like a single act, now you can fractionate into very many components, and in Parkinson's you have difficulty with these components. So you can do kind of one thing at a time. A Parkinson's patient may never be able to put their legs back. So just that simple action, you can never stand up with your foot in front.
Right.
So therefore, it is the movement disorder lies in the fact that a person loses control of these unconscious or involuntary movements. Now, many people recognize Parkinson's by abnormal movements like tremor.
Right.
You can have Parkinson's disease without any tremor.
Right.
And I think that when we look upon visual images, which are present in people's minds with respect to particular diseases, then Michael J. Fox comes up always as an image of somebody with Parkinson's, which is actually very unfortunate. because Michael J. Fox does not present a picture of classic Parkinson's disease.
He doesn't have the tremors. So
it's not a question of tremor.
He's got tics.
That is precisely it.
Right.
So what I began by saying that Parkinson's disease is an absence of movement, where a person is frozen, that a person is stooped, and they lose facial expression, they lose the fact that when we talk, we gesticulate, with these random movements, these unconscious movements are lost.
Right.
Now, on the other hand, the picture that you just showed is an excess of movement, where you do not need to move, but you are moving. So it is, in that sense, it is diametrically opposite to the picture of true Parkinson's disease.
Okay.
So what is it that Michael J. Fox has? Michael J. Fox has Parkinson's disease, but he's completely masked by medication effect, which pushes him over to the other side. So he has what is called drug-induced chorea. So the picture people have in mind when they see him, and they believe that that is Parkinson's, that is actually the opposite of Parkinson's disease.
And what he is doing is because of the medication causing that to happen, not the disease.
That's right. So the point is, where you have an absence of movement or a paucity of movement, then the medications are designed to increase the movement. So if you push those medicines beyond a certain level, you will find that a normal person will do the same thing. If you gave the same medications to a normal person, they'll do it at a much lower doses than what he has.
Right.
But then it is unfortunate that that picture gets imprinted in people's minds, and they believe that that is what Parkinson's disease does.
Right.
I do not know that there are good visual images of celebrities, except I would say it would be Muhammad Ali.
Okay.
Now, if you look at the picture of Muhammad Ali versus Michael J. Fox, for whatever reason, Michael J. Fox got more TV time than Muhammad Ali did, at least in today's generation. So those are visual images of the disease that you will see that is so characteristic. If you look at Muhammad Ali's face, you will see that stare, where he absolutely has an absence of facial expression, is a very characteristic picture. And of course, the tremor as was there in him, and other celebrities who have had it. You know, I believe Katharine Hepburn was one that. Those are images that we can look in our mind's eye and draw some inferences from there.
Now, my dad had, he had the dementia, and then all of a sudden my mom calls me and she said, something has happened to your father. You need to get down here. So I went down there, and when they came to pick me up at the airport, immediately I noticed when he got out of the car that he had to think about how you just open a car door and you get out,
right.
And that's that. Well, what I immediately noticed is that he had to think about putting his leg outside the car and setting it down, and then and then when he would pull it, how you just know the strength that you don't even think about it.
That's right.
And when we had him, he was diagnosed with Parkinson's related to dementia, because that degenerative was going on to where the Parkinson's, and he would have that blank stare, and his motor functions got slower to where it wasn't just automatic. He had to think about movements, and some he couldn't even do anymore on a natural basis. And so sometimes when you have one degenerative, they can lead into others.
Well, it's not that they lead into other. Like I said, the brain is one organ.
Right.
So when you have a degenerative process that begins in one area, soon it spreads and involves others. So in the end, they all kind of look the same.
Okay.
So Parkinson's disease, as it progresses, also includes dementia.
Right.
Whereas, there are other conditions, for example, Lewy body dementia, which is a dementia and Parkinson's disease thrown together. So as a definite entity. And then you have Alzheimer's, which sometimes can have characteristics that you see in Parkinson's disease because of the same process, because of the same brain.
Can we go to break and come right back and finish this?
We're going to talk about mad cow when we come back.
and I also want to ask you real quick before we go to break. I want to get this out. When you have a certain disease of the brain that causes you to have Parkinson's, Alzheimer's, whatever, basically what you're saying is the loss of the brain cells cause that to happen, and I guess wherever the more of brain cell loss is what decides what affliction you're going to have.
That's right. That's right.
Okay.
There are definite areas of the brain which are related to specific functions. We know that.
Right.
There are large areas of the brain which we don't know what they do. We call them the silent areas of the brain. But then there are specific areas which deal with motor function, specific areas that deal with speech, specific areas that deal with vision, with smell.
Okay.
You know, so we have these areas. So if any condition predominantly affected any one of these, the manifestation will be first with respect to the area that is involved.
Okay, okay, good deal. We're going to come back with more of Dr. Kundu in just a few here on Tennessee Valley this
Mad
morning.
cow.
Stay tuned.
I'm Dr. James Markham, host of the television program Heart of Health, seen right here on WTNB television, Thursday at 7 o'clock, Friday at 8 a.m., or Sunday at 3:30 p.m.
How would you like to look and feel better? If so, then visit the Ford Center for Anti-Aging, located at 2020 Key Street Northwest. Dr. Ford has been serving Cleveland and the surrounding area since 1984. He is a licensed physician with the Board of Anti-Aging Medicine, offering affordable Botox injections. Botox is a medication that is used to treat dynamic wrinkles such as crow's feet, forehead lines, and frown lines. In addition to Botox therapy, rejuvenate and smooth wrinkled skin. The micro-laser peel treats skin conditions associated with aging and active lifestyles. If you're looking for safe and affordable anti-aging treatment, call the Ford Center for Anti-Aging at 423-614-0535, located at 2020 Key Street Northwest.
Yeah.
Welcome back, Tennessee Valley this morning. Joe and Kim Payla with you on this Wednesday with Dr. Subroto Kundu, talking about brain, Parkinson's disease, loss of brain cells,
right.
degenerative
and we were
diseases.
talking during the break about alcoholism
Yes.
is one of
Plays
the
a big part.
prominent brain cell killer.
That's right. I mean, when we talk of neurodegenerative diseases, I mean, the issue remains vague because we do not know what is it that is causing the cell death. And here we are with a very common, well-known agent for cell death, which is alcohol.
Right.
So alcohol is a neurotoxin. So there are many other neurotoxins that have been described, and some are very, very specific. There is one agent which we call MPTP for short. I mean, I don't want to expand those letters, but that chemical has been known to specifically affect that same area of substantia nigra that I was talking about. So if you can give a tiny dose of that, you can actually reproduce clinical Parkinson's disease, and we know that. So it has become an excellent tool for study. And that's a classic neurotoxin. That means this cell almost is programmed in the body to go and hit those brain cells. Now, alcohol is a diffuse neurotoxin that it is pretty much lethal to nerve cells anywhere in the body.
So any alcohol you drink at any given time could kill brain cells, or is it over a period of time?
It is over a period of time because what alcohol, when it's taken in the body does its best not to expose the brain to the alcohol. What does that mean is that the liver, which is really the big barrier to any toxins, it detoxifies alcohol. So it is only when the liver system is flooded and alcohol actually goes into your bloodstream, and it's only then it can go to the brain. So you have to give that in a sufficient concentration. And yes, the damage is quite is cumulative, because as we talked about, that if the cell is in fact dead, then it never comes back. So all you can do is have more death. And lo and behold, you have a shrinkage of the brain, and you have the atrophy picture in the MRI, same as you have it in Alzheimer's, in chronic alcoholism. And a lot of those people with chronic alcoholism will behave exactly the same thing as dementia. They will show even features that resembles Parkinson's disease.
That's why they call it pickling the brain, because it shrinks.
That's right, it is.
Hit on mad cow real quick. We promised them that you talk about mad cow.
well-
Just a little. We're just about done.
Well, again, the reason why the mad cow would become a consideration in this discussion is because here is another type of agent that affects the brain cells diffusely and kill it, only that in this case we know what the agent is. And that agent happens to be a very strange particle, and it's a protein particle. We did not know in the past that a protein particle can reproduce and regenerate and procreate almost same as a cell can. So then therefore we needed DNA, we were told, before you can replicate. It turned out not to be true. There was a gentleman by the name of Stanley Prusiner at UCSF, University of California at San Francisco, who had a pivotal work in 1983 where he demonstrated that it could be a protein particle that did that, and that brought in the whole concept of prion mediated. Prion meaning it's a protein. He called it prions, and that was found to be the common factor behind a number of neurodegenerative conditions which resulted in death. And it turned out that this mad cow disease is part of this same prion base.
Okay.
Yeah.
And then we go into other disease conditions in the body, in humans and in animals, because the difficulty with mad cow is that it is a cross-species transfer. So the cows had the problem, and then when human beings ate that meat, they got it.
Right.
And so this cross-species transfer is what makes the mad cow problem so relevant, and yet there are conditions in humans, the most important is called Creutzfeldt-Jakob disease, where you have a similar type of affection in an individual who has not necessarily been known to be exposed to a certain agent, so it's considered sporadic.
Well, Dr. Kundu, if you tell someone how they can get in touch with you if they have some other questions they'd like to ask about.
Well, I am in town and have my practice on Chambliss Avenue,
Okay.
at 2253 Chambliss Avenue, and my telephone number is 423-790-1529.
You can Google him, or you can look him up in the yellow pages if you're doing it the old-fashioned ways. But if you have any questions, or if you
This
have
is the man to answer your
this is the man
question.
to
I'm
answer your
sorry, but
question.
I do not have a yellow page.
No ad, but he's
I never
still
had
listed.
one.
He's in the book.
But he's still in there.
He's
so
in the book.
He will be.
Well, Dr. Kundu, thank you so much for being with us. Dr. Kundu will be back with us again next month, and we'll talk more about brain problems because they're everywhere. And as
But
you
we've
can
got a
see-
lot in our house.
Yeah, there's a lot in our house. But in any case, we thank you for joining us this morning on Tennessee Valley this morning. Have yourself a great day, and we'll see you next Wednesday. Be careful going to work, 58 degrees. We'll see you next Wednesday on Tennessee Valley this morning.